Okay, so today I'm here to talk to you about my personal experience with catheter ablation for SVT. First of all, I just want to say that I've never done a YouTube video before or anything, so you guys kind of got to bear with me a little bit. But pretty much when I was searching for videos about the procedure, when I was waiting to have mine done, I didn't really find anything with the whole story. I kind of found a lot of things with just the symptoms, and then just strictly the surgery, and then just strictly the post-op. So I just kind of want to make a video to tie it all together from when I first started having symptoms till right now. So basically, about 3.5 years ago, I played baseball in high school, and it was end of my junior year in high school, and I was pitching, and I threw the ball or whatever, and as soon as I made like the jerk movement, like just a quick movement on my body, I just out of nowhere, never felt this before in my life, just felt like a rush of sensation on my chest, and then within 10 seconds I noticed that my heart was just beating faster than it ever could normally beat, like from running or anything. Just like an extremely uncomfortable feeling. I didn't really know what it was, but I didn't want to make a big deal about it or anything, so I kind of just hoped it would go away, and within 5-10 minutes it went away, and didn't really think about it again. I just hoped it was like a one-time weird thing, anxiety or something like that. I had no idea. So about 2 months went by, and then I was making another movement, very similar movement. I bent down to tie my shoes really quickly, so it was like the same quick movement down, and again the same thing, the rushing sensation and the palpitations that followed. So after that I knew it wasn't just like a one-time crazy thing, so I told my parents about it, and we went to see a cardiologist. Basically they did all the normal tests, the EKG, the echocardiograms and all that, and thankfully everything came back normal, so at least we knew it wasn't like some crazy, I have no idea, life-threatening issue. So over the next few months, maybe every 3-4 weeks, I'd have another episode, and so we finally got a Holter monitor to wear for 30 days, and this was about 1.5 years after I first started having the symptoms. So I wore the Holter monitor for 30 days, and crazy enough, that 30 days was like the first 30 days in a year maybe where I did not have any of the palpitations or any of these episodes. So that kind of was pretty annoying. So we didn't really know what to do after that. I just kind of, the whole freshman year of college, I just kind of dealt with the episodes as they came, and then the next summer, I was wearing another monitor for 30 days, and finally we caught one, and it was weird because the one that we caught was the longest episode I ever had in my life. It was like 1.5 hours of just, I think it was from like 175 to 190, my pulse. But pretty much all my episodes normally were anywhere from 2 minutes to 30-35 minutes on average. And so basically after they caught it, he said that you have some form of SVT. Obviously they don't know exactly what kind until they do the EP study, which is right before they do the ablation. So he gave us some options. I could go on beta blockers and see if that helped, or we could do the procedure. So basically I tried out beta blockers. They didn't really work. So about 1 year later, which was about a little over 6 weeks ago, right before my junior year of college. So right now it's October 1st. I had the procedure done on August 19th. We obviously decided to get it done. And people always say the worst part is like waiting before and being anxious that you're going to have heart surgery, but realistically, like, you know it's for a good reason. You know it's a 99% sure, safe procedure. Like, if something goes wrong, it's really a freak thing. So I wasn't too worried about that. And the day of, basically, we have a family friend who was in the pediatric department at this hospital. So I was able to go in the hospital as a pediatric patient, even though I'm 20, which was, I mean, that was good because I got extra care, like more nurses, I had more people, more eyes on me, I guess. So I went in there the morning of the surgery about 10 o'clock, which is when they told me to come in, and he was doing one more procedure before me, so I didn't actually start until 12:30, but from 10 to 12:30, pretty much, they just took my information. I met with the anesthesiologist. I had to get general anesthesia, like the tube in the throat and everything. It's kind of annoying. I kind of had a sore throat after, but nothing too crazy. I met with the doctor. He explained the procedure like the millionth time. And basically, they wheeled me down after all that when they were all ready. They put a mask on me so that I'd pass out, and they could do whatever they needed to do to prep for surgery. And that was about it. That's the last thing I remember. I woke up 5.5 hours later. Mine was super long. Normally, you'll get told the procedure anywhere from 2 to 3 hours normally, I think. But mine was 5.5 because I actually had 2 different kinds of SVT. I had AV NRT, like the AV nodal reentry tachycardia, which is on the right side of the heart. And I also had WPW, which is on the left side, so they had to do the transeptual puncture and do both. And I had 21 burns, which I guess is on the higher end because I had 2 different kinds, which is extremely uncommon, I guess. It's literally like having, I guess, chance of having SVT times whatever the chance of having SVT is, because I had both. Kind of crazy, I guess, but basically that wasn't a big deal other than the length of the surgery. Recovery was pretty much the same. The only big issue I was having really was just extra heartbeats. They said that was totally normal just because of how much trauma the heart goes through during this. So first week I was probably having 200 or 300 PACs or PVCs a day, which sure, if you're getting the surgery, you're familiar with those. It's just the atrium or the ventricle. I think they beat like a little bit too early. It's kind of an extra beat. So basically that was it. Like like I said, I'm a little over 6 weeks out, and those beats got less and less, and now to the point where maybe I'll have 1 or 2 a day, but usually I don't. The heart just kind of needed time to heal a little bit. But as a whole, the surgery went well. They think that they got it. I haven't had any episodes or anything like that. I haven't felt any flutter with deep breath. Like, I had trouble, especially in the past year and a half, playing sports or running around or stuff like that. It kind of was really difficult, but now like today, I've just started running again. I felt good. So I'm hoping that, was successful and that I don't have any problems as a result. But as a whole, just get it done. I would recommend getting it done for sure. Like, people always say, oh, it's heart surgery, it's a little bit scary, but it's much better than having to deal with all these episodes. I know when you have these episodes, you think, oh my god, like, even though they tell you it's SVT, no one dies from SVT, that it's super uncomfortable, it's super frightening. So it's kind of worth it to get it done and don't ever have to deal with it again, hopefully. So that's about it. I just want to kind of tie it all together, before, during, and after. Like I said, I was having the symptoms for 3.5 years. Didn't want to deal with it anymore. Just get the surgery. It's not that scary. You go in the day of, you get it done. You don't really remember much. The recovery period is not that bad. They actually had to go in my neck and one catheter in my neck, 2 catheters in my groin, and 1 in my left groin. So I had 4 in all, 3 in my groins, 2 in right, 1 in left, 1 in neck. So, I mean, they say that could be a little bit annoying after, but I mean, it wasn't really anything. They put little bandages on them. 2 or 3 days later, I took the bandages off. There was no blood or anything. Just as a whole, nothing really to worry about. Recovery's easy, pre-op's easy, everything. Just go for it. You don't ever got to deal with it again. If anybody has any questions, feel free to message me or whatever, email me. I'd be glad to answer any questions. I just kind of felt obligated to make this video because I didn't really find one similar to this when I was looking, so I just kind of wanted to help everyone out there who's also going through it, because it was kind of just a stressful thing to have to deal with. And that's about it. So if you decide to do it, I wish you the best of luck. If you got any questions, let me know.